If you are a man above 50 and of late have started waking up multiple times at night to urinate, or struggling with a weak urinary stream that does not go as far as it used to earlier, or feeling like your bladder never fully empties, please do not dismiss it as just getting older. Your body, urinary tract, and specifically the prostate gland may be trying to tell you something. Hi, I am Dr. Rishi Nayyar, professor in the Department of Urology at AIIMS New Delhi. What I just described is not a random collection of inconveniences, it is a pattern, and that pattern has a name: lower urinary tract symptoms, benign prostatic hyperplasia, BPH, or simply called as enlarged prostate. It is one of the most common and frequently ignored conditions in men above 50. It is common, but it is not something you simply have to live with, because it hampers your daily life, sleep cycle, productivity at work, and quality of life as well, besides having medical complications also. So what is BPH or benign prostatic hyperplasia? The prostate is a small walnut-sized gland sitting just below the bladder surrounding the urethra. As men age, the prostate grows in size naturally. In many men, this growth compresses on the urethra, causing urinary symptoms that gradually worsen over time. Can BPH cause cancer? No, not at all. It does not become cancer by itself. But if left unmanaged, it significantly affects the quality of life and in some cases leads to serious complications including urinary tract infection, urinary retention, and even kidney damage. It is unfortunate that we continue to see so many patients presenting with loss of kidney function due to this entirely preventable disease process. So what are the symptoms of BPH that should bring a man above 50 years of age to a urologist? These are the symptoms like waking up 2 or more times at night to urinate, a weak or uninterrupted urinary stream, difficulty in starting urination despite the urge, a persistent feeling that the bladder is not fully empty, or a sudden and urgent need to urinate. These symptoms generally start mild and are easy to dismiss, but they worsen progressively, and the earlier they are addressed, the more treatment options are available. So now what are the treatment options? First thing to know is that the BPH is very much treatable. There are many options available like lifestyle changes, medications, minimally invasive surgical procedures, and major surgeries like TURP or laser enucleation. Lifestyle changes include moderating the overall fluid intake, reducing the evening fluid intake, specifically taking diuretic medications in daytime, and limiting intake of caffeine and alcohol, etc. Medications are also available which can relax the prostate and bladder or even shrink the gland over time, and these medicines are used most frequently. Minimally invasive surgical procedures are used for symptoms that do not respond to medicines, while surgeries like TURP or laser enucleations are performed only for some cases that do not respond to medicines over time. Now, every man will have a question that if he has these urinary symptoms, does it mean that he should start the treatment for prostate enlargement immediately? No, not every urinary symptom means it requires some form of active treatment immediately. In fact, a large proportion of enlarged prostates and associated urinary symptoms can be managed simply by lifestyle modifications only, as I told earlier. More importantly, one should note that urinary symptoms seen with benign prostatic enlargement can also be seen with other urinary diseases like prostate cancer, bladder diseases, neurological diseases like stroke, spinal cord injury, etc. Therefore, before commencing any specific treatment, one must take consultation from a urologist. Important is to be aware and not ignore these symptoms as age-related normal changes only, and please do not start treatment on your own. An enlarged prostate is common, manageable, and nothing to be embarrassed about, but a worst thing that one can do is to ignore these symptoms and hope they go away on their own. If you recognize any of these symptoms, please see a urologist and share this video with every man above 50 in your life. Thank you for watching.